It's incredible to think that just over 2 years since COVID-19 began spreading, there are now multiple safe and effective vaccines against it, and more than 10 billion doses have been administered globally. The tragedy, of course, is that billions of people are yet to benefit from these life-saving tools. Currently, 116 countries are off track for our shared target of vaccinating 70% of the population of every country by the middle of this year. More than 80% of the population of Africa is yet to receive a single dose. Much of this inequity has been driven by the fact that globally vaccine production is concentrated in a few mostly high-income countries. One of the most obvious lessons of the pandemic, therefore, is the urgent need to increase local production of vaccines, especially in low and middle-income countries. That's why, in April last year, WHO issued a call for expressions of interest for establishing a technology transfer hub for mRNA vaccines. The aim of the hub is to provide a facility where manufacturers from low and lower middle income countries can receive training in how to produce certain vaccines and the licenses to do so. In June last year, we announced our decision to establish the hub in South Africa. As a partnership between WHO, Afrigen Biologics, the Biologicals and Vaccines Institute of South Africa, or BioVac, the South African Medical Research Council, the African Centers for Disease Control and Prevention, and the Medicines Patent Pool. I'm delighted to announce the first 6 African countries that will receive technology from the hub to produce their own mRNA vaccines: Egypt, Kenya, Nigeria, Senegal, South Africa, and Tunisia. WHO will work with the companies and the government in each country to develop a roadmap for training and production based on their needs and capacities. We're very honored to be joined today by the presidents of all 6 countries, as well as President Macron, President Charles Michel, and President Ursula von der Leyen. The leadership and support of the European Union, the European Commission, and the European Council have all been essential in bringing us to this point.
Today really marks a new dawn, a dawn of hope and promise for the African continent and indeed all her people. Leaders also in biomedical research, Kenya is truly honored today to be listed as one of the beneficiary countries of the mRNA Technology Transfer Program, and this is indeed a testament to the caliber of the scientists present within our institutions across our region and indeed the entire African continent. This announcement also announces and demonstrates the power of partnership to change the trajectory of Africa's health security for the better. Indeed, as soon as WHO announced the emergence of this novel pathogen, we witnessed an unprecedented scramble for medical supplies necessary to mount an effective response and save lives. The global supply chain, as we all know, and one that we had prior depended on, failed to meet the increasing demand, and it soon became the case of the wealthiest countries having the best chance of accessing life-saving commodities. And this, if we recall history, was a case with HIV, and it was once again history repeating itself. In many ways, the COVID-19 pandemic was a wake-up call for many countries. As African heads of state, serving a population of 1.2 billion people, we were confronted with the unacceptable reality that 99% of vaccines were sourced from outside our continent, despite Africa accounting for 25% of global vaccine needs. Therefore, today's event is without a doubt an immense and of historic significance. The Technology Transfer Program, once successfully implemented, will without doubt set Africa on a sustainable path of self-sufficiency in terms of vaccine supply. Let me also say that it is my fervent desire that this collaboration will be explored also in other areas such as the manufacture of medical devices, biosimilars, and other emerging areas of biomedical research. As a global community, perhaps the most significant effect it may have will be to rebuild public trust in the ability of multilateralism to come together to address humanity's most pressing challenges. This is the time for all of us to build back better, and let us spare no effort and guarantee our future generations a healthier and a much more sustainable world.